The last chapter for this week is going to be discussing the nutritional requirements for older adults now and their eating habits and how that affects their oral health. Obesity is the most common nutritional disorder with older adults. It contributes to many of the common chronic diseases such as diabetes, cardiovascular disease, and it exacerbates age-related decline in their physical ability and can lead to frailty as well. Some of the risk factors are less education and income. Many of these elderly people are housebound, especially if they are widowed and living alone. Many times physical disabilities, and even if they don't have disabilities, they don't get along or around like they used to. Sometimes they have had their ability to drive taken away from them. So those are all things to think about. Sometimes depression and other mental health issues become a problem and they just don't have the desire to eat. And drastic changes in their life, such as death of a spouse, loss of their home, moving to an assisted living residence, all of those things can affect their desire and ability to eat healthy. Some of the oral cavity and oral health issues might include chewing difficulty. If they have dentures or if they're missing teeth, they could have difficulty chewing. Swallowing can be a problem too for older people as they get older for a multitude of reasons. Sometimes they experience mouth pain if a denture is not fitting well, if they've had any kind of treatment for cancer or things like, there's lots of things that can cause problems in the mouth. If they have candidiasis, these all can be risk for malnutrition. They do also show changes in their taste and smell, which can then increase their desire for carcinogenic foods. They want things sweeter, they want things to taste more. So they will add sugar to things, they'll add salt to things. All of those things, as we know, can affect their health. And then xerostomia or dry mouth is a problem because they're gonna, if their mouth is super dry, they're gonna avoid crunchy, dry, sticky foods, and they'll choose things that will stimulate saliva. So hard candies and things like that are going to increase their risk for decay. As adults age too, they typically have more recession. Now we've got root exposure, and as we know, the root of the tooth is not covered with enamel, so it is way more prone to decay. So we see a higher number of root caries in patients as they age. Xylitol is the sugar alcohol or substitute that we're seeing in a lot of products now, and there are many products specifically made for dental patients that contain this because it is anti-cariogenic. So they can still get that relief of stimulating their saliva and having something in their mouth that tastes good without inducing caries. Periodontal disease, the risk increases as we age. And if they have periodontal disease, it can be painful and they could have mobility. So that's going to decrease their desire to eat and can lead to weight loss. The quality of nutrient intake decreases as the number of teeth decrease. So people with fewer than 28 teeth have significantly lower intake of fruits and vegetables and things that require teeth to be able to chew them. And then lower serum levels for beta carotene, folate, and vitamin C result. The GI tract, changes in their motility, and there can be a decline in nerve function, which can lead to dysphagia, the difficulty in swallowing. Again, that achlorhydria or diminished hydrochloric acid can affect their absorption of calcium, iron, and vitamin B12. Constipation is often a problem due to the altered GI motility. So benefits could be gained for these patients from more fibrous foods. They need to make sure they're taking in enough fluid and they're getting enough activity, which both of those items are difficult for elderly. The fluid intake is a problem because they have a decreased thirst is associated with aging anyway. And then if they have a problem with incontinence or nocturia, where they wet the bed or they can't hold their urine, they're going to shy away from liquids even more because that's an embarrassing situation that they want to avoid. There are certain chronic illnesses such as heart and kidney disease that can lead to impairment of their homeostatic mechanisms that control their fluid balance. So if they have heart or kidney disease, that's going to affect their hydration status as well. As far as their musculoskeletal system, bone resorption progresses rapidly, and they therefore could be at a higher risk for fractures, which could lead to a disability. After about 45 years of age, our lean body mass declines up to 0.4% per year, and adipose tissue increases. So inactivity leads to a loss of that muscle strength and balance, which can lead to falls. So maintaining muscle is essential to reduce the risk of falls. So, light weights, even little hand weights, moving around, things like that are going to be really important for these patients rather than just leading a sedentary lifestyle. That decline in lean body mass results in decreased basal metabolic rate in turn. And sarcopenia, we've mentioned this before, but what sarcopenia is a reduction in our skeletal muscle that is then replaced by fat in older patients. Socioeconomic factors can also affect these people on fixed income. So inflation, failing health and medical bills, cost of medications, all of those things are going to affect the ability of this patient to provide healthy diet for themselves. There's the Title III nutrition program for elderly, which is known as Meals on Wheels, which is a wonderful option if it's available. They come out twice a day and brings well-rounded nutritional meals to people that are homebound. The psychological factors that can affect patients are apathy and depression. These things can decrease their appetite and their interest in food. Unfortunately, sometimes, especially if they've experienced the loss of their spouse, or if they have some sort of disease or condition that is maybe causing them to lose control of their bladder or things like that that can just affect your whole outlook on life, can decrease their desire to live. They become apathetic, they become depressed, and they just kind of stop eating or don't even really take an interest in nutrition anymore. There are revised daily recommended intakes for individuals ages 51 to 70 and then 70 and beyond. We want maintenance of body functions will require the same amount of macronutrients. There are increased requirements for some of the micronutrients. Some of those we talked about were vitamin D, calcium, things like that. Calorie needs decrease with age, but protein needs do not. Because their basal metabolic rate decreases, their caloric needs decrease, but they still need that protein to help combat that sarcopenia. Protein needs are proportional to their body weight, so approximately 25 to 30 grams of high quality protein will maximize muscle protein synthesis. A third of adults over 50 fail to meet the RDA for daily protein intake, and weight loss will not always increase the lifespan. Many times we think if they just lose weight, they'd be better. They need to not only lose weight, they need to increase muscle. And by doing that, they need to move. And when I say lift weights or do resistance training, it's anything that they do can help their bone production and density. It doesn't have to be a lot. It can be a little 2-pound weight or little rubber bands or something like that for resistance. They don't need to be in the gym pumping serious amounts of iron, but moving is so important in order for health. Vitamin D, like I said, is one of the vitamins that requires more. ages 51 to 70, it's 15 micrograms, and then once we reach 70, they bump that up 5, because 30% of people 60 years and over in lower latitudes have vitamin D deficiency in the winter. They aren't exposed to the sunlight as much. They stay indoors. And then also 10 to 30% have a reduced absorption through their skin. 10 to 30% have reduced absorption of vitamin B12 due to the achlorhydria in their gut. But vitamin D, our skin does not produce it from the sunlight like it did when we were younger. So as we get older, our skin isn't as efficient at making that vitamin D for us. The recommended daily allowance for folic acid, vitamin B6, and B12 increased to prevent that decline in cognitive function and to reduce the risk for coronary artery disease. Some neurological symptoms similar to dementia can result if a patient is deficient of B6, B12, and folate, which would be hard to diagnose in an elderly patient because there are so many older patients that do have cognitive decline. So those symptoms sometimes may go unnoticed, or someone may just think that the patient is just suffering from normal dementia when really it could be a deficiency. Calcium intake increases from 1,000 milligrams a day to 1,200 milligrams a day, which is 200 higher than for, a younger adult. And this is to maintain bone mass and reduce the risk of osteoporosis. Decreased physical activity can lead to a decrease in that bone density like we were talking about. So physical activity is key. Sodium, the upper limit is 2,300 milligrams a day. We want to keep that below 2,300 milligrams a day. And it's going to be adjusted based on physiological condition. If a patient has congestive heart failure or high blood pressure, a lot of times it's a 1,500 milligram per day maximum, but if not, it's 2,300 or below. Some older adult deficiencies due to poor diet are 1 in 4 older adults consume fewer than recommended servings of meat. It's often due to cost. It could also be due to inability to chew meat. Dairy products, fruits, and vegetables are frequently lacking in the diet because if you think about dairy, fruit, and vegetables, those are things that need to be replaced weekly. If someone lives alone, sometimes they're not going to go to the trouble to prepare those kinds of foods. And milk, fruit, and vegetables can be expensive and require, like I said, frequent trips. So a choice of soft foods usually results in a decrease in protein and an increase in fermentable carbohydrates, which can lead to, again, caries, which in older adults, like we stated, would probably manifest itself as root decay. Snacking and nutritional supplements can ensure that these older adults will get an adequate amount of calories as well as protein. And some healthy snacks that you could recommend would be cheese, hard-boiled eggs. Eggs are easy, they're not expensive. Low-fat milk products, bananas, canned fruit if we are avoiding the heavy syrups. Milk-based food supplements such as instant breakfast mixes can be economical and help prevent nutrient deficiencies. They also make a lot of the Ensure and Sustacal commercial liquid nutritional supplements that are more convenient for patients too. They can be costly, but they're handy because it's just in a bottle. You can get chocolate flavored, vanilla, banana. They pull them out, open them up, and drink them, and they're getting their protein, they're getting their vitamins and things like that. So those can be a wonderful suggestion as well. Older adults are also very susceptible to foodborne illnesses, like we talked about in the pregnant patient. For older adults, they have oftentimes a compromised immune system. They have a decrease in that hydrochloric acid in the stomach, which helps fight many bacteria. They also have a lessened sense of smell and taste, so they may not be as aware of how their foods smell, if the food is still good, has it passed its date, those kinds of things. So those are all things to consider as far as food safety with older adults. Older Americans need more whole grains, vegetables and legumes, fat-free or low-fat milk products, and food and beverages that are low in sodium as well as added sugars. My Plate for older adults is a wonderful resource for them to focus on the needs unique to that aging process. Eating should be an enjoyable routine, and it's never too late to make changes in their eating habits. What we could suggest when they're selecting foods is to buy a variety of fresh, frozen, or no salt added vegetables. So if fresh isn't a good option, frozen is the next best option. And if they buy frozen vegetables, those things can be stored and you don't have to go to the store as often. They're more expensive, but they even make like little individual serving containers of those now, which is handy. They could do no salt added vegetables in a can. And then, like I said, fruit packed in its own juices would be good as long as they're not in those heavy syrups. We could recommend to choose reduced sodium varieties of beans, salad dressings, baked products. Dried fruit and unsalted nuts could make a good portable snack, and advise them to be very careful in restaurants. Luckily today, many of the restaurants have nutritional information for their meals, but so many of the restaurants, anything prepared or purchased out usually contains a ton of sodium, fats, those kinds of things. So that would be something that they would need to be very aware of and ask questions and ask for that nutritional information.